Before you start taking Kaletra Solution, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth with food as directed by your doctor, usually twice daily. It's important to measure the dose carefully with a special measuring device/spoon, and not to use a household spoon. If you are using a feeding tube, ask your doctor or pharmacist if this medication may be given through your feeding tube. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. It's important to tell your doctor and pharmacist about all the products you use. For children, the dosage is also based on age, weight, and height. Once daily dosing of this medication is not recommended for children younger than 18 years of age. If you are taking didanosine in addition to this product, take it 1 hour before or 2 hours after taking this product. It's very important to continue taking this medication exactly as prescribed by your doctor. Do not skip any doses. For the best effect, take this medication at evenly spaced times. To help you remember, take this medication at the same times every day. Do not take more or less of this drug than prescribed or stop taking it, even for a short time, unless directed to do so by your doctor. Doing so may cause the amount of virus to increase, make the infection more difficult to treat, or worsen side effects. Some common side effects of Kaletra Solution may include diarrhea, headache, nausea, vomiting, stomach upset, drowsiness, dizziness, a bad taste in the mouth, and trouble sleeping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. As your immune system strengthens, it may begin to fight off infections you already had, which could cause disease symptoms to return. You could also experience symptoms if your immune system becomes overactive. This reaction may occur shortly after starting HIV treatment or even several months later. It's crucial to seek medical help immediately if you experience any serious symptoms, such as unexplained weight loss, severe tiredness, muscle aches, headaches, joint pain, numbness/tingling, vision changes, signs of infection, signs of an overactive thyroid, or signs of a nerve problem known as Guillain-Barré syndrome. If you experience any serious side effects, including nausea/vomiting, fever, increased thirst, blurred vision, confusion, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine, it's important to inform your doctor right away. Seek immediate medical help if you experience symptoms of a heart attack, severe dizziness, fainting, difficulty breathing, seizures, muscle weakness, or signs of kidney problems. Discuss the risks and benefits of treatment with your doctor, as well as the possible use of exercise to reduce the potential changes in body fat that may occur while taking this medication. Additionally, consult your doctor or pharmacist for more information about cholesterol and triglyceride testing, as this medication may cause an increase in blood fat levels. While rare, a very serious allergic reaction to this drug is possible. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report side effects to the FDA, and if you are in Canada, you can report side effects to Health Canada. Before taking Kaletra Solution, it's important to discuss any allergies you may have with your doctor or pharmacist. Also, inform them about your medical history, especially if you have liver disease, diabetes, heart problems, or a history of certain infections. Kaletra Solution may affect your heart rhythm, so it's crucial to discuss any existing heart conditions or family history of heart problems with your doctor. Additionally, low levels of potassium or magnesium in your blood may increase the risk of heart rhythm issues, especially if you are using certain medications or experiencing conditions such as severe sweating, diarrhea, or vomiting. This medication may cause dizziness or drowsiness, so it's important to avoid driving or using machinery until you know how it affects you. It's also important to limit alcohol consumption and discuss marijuana use with your doctor. If you are pregnant, it's important to discuss the risks and benefits of using the tablet form of this medication with your doctor, as the solution form contains alcohol. Additionally, if you are breastfeeding, consult your doctor before using this medication. Overall, it's important to communicate with your healthcare provider about any concerns or questions you may have regarding the use of Kaletra Solution. When taking Kaletra Solution, it's important to be aware of potential drug interactions. This medication can interact with a variety of other drugs, including certain HIV medications, drugs to treat erectile dysfunction, and medications that affect the heart rhythm. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safe and effective use of Kaletra Solution. Additionally, it's important to note that the solution contains alcohol, which can interact with certain drugs and cause severe nausea and vomiting. It may also decrease the effectiveness of hormonal birth control, so it's important to discuss alternative forms of birth control with your doctor and use an effective barrier method during sexual activity. Be sure to talk to your doctor or pharmacist about any other products you are taking that may cause drowsiness, as well as checking the labels on all your medicines to ensure they can be used safely with Kaletra Solution. And remember, always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Kaletra Solution and shows serious symptoms like passing out or difficulty breathing, or if a child ingests this medication accidentally, call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include numbness or tingling in the arms, hands, legs, or feet, a change in the amount of urine, severe drowsiness or dizziness, loss of consciousness, and shallow breathing. When taking Kaletra Solution, it is important to not share this medication with others. It is also important to have regular lab and medical tests, such as liver function, blood count, blood cholesterol/triglyceride levels, and blood sugar levels while taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. Kaletra Solution is available in tablets, capsules, and oral solution. If your doctor instructs you to switch types of this medication, be sure to follow their instructions carefully. If a dose of Kaletra Solution is missed, it should be taken as soon as remembered. However, if it is close to the time for the next dose, the missed dose should be skipped, and the next dose should be taken at the regular time. It is important not to take a double dose to make up for the missed dose. Make sure to store Kaletra Solution in the refrigerator. If you have the US product, it should be used within 2 months if stored at room temperature, and if you have the Canadian product, it should be used within 6 weeks. Avoid exposing it to high heat and do not store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product when it is expired or you no longer need it. If you're unsure about how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.